Good afternoon, everybody. Thank you very much for joining us this afternoon for the last session of the Professional Care Workers Week 2022. For this session, I am joined by lovely and very prominent academics in the field of social care. And I have with me Professor John Glasby, Director of the Impact Center, Professor Sheereen Hussein, lead research at Center for Care from the London School of Hygiene and Tropical Medicine, and Dr. Karolina Green, postdoctoral fellow at the King's College London, NIHR South London. Thank you very much, all three of you, for joining us this afternoon. I'm really looking forward to this session. And if it's okay with you, let's start. And my first question is for you to share the work that you are currently involved in, with a particular focus on the workforce. So, John, if it's okay with you, I'd like you to go first. Thank you.
Thanks very much, Karolina, and thank you for the opportunity to be part of today's event and part of this week. As Karolina said, I head up the Impact Centre, which stands for Improving Adult Care Together, and is the new UK centre for implementing evidence in adult social care. And when I trained as a social worker, somebody who went on to be quite senior actually in social care said to me quite early on in my training, "You'll make a good social worker, John. The trouble is you think too much." Now I know what they meant. You've got to earn the right to ask questions sometimes. You probably can't ask too many questions all at once. You've got to ask things in the way that the other person can hear, and you've got to learn to walk before you can run. I'm sure I was a very annoying student. But deep down, I think the young me was trying to say, why are things the way they are? How could they be different? And how could I be part of that? And those are questions that I'd want everyone connected to social care to be asking of themselves and their practice and their organisations. I also think the way it was framed is quite kind of interesting. You think too much, as if that's a kind of criticism. You know, something as important as adult social care, with something that touches people's lives in such intimate, fundamental ways, how could you ever possibly think too much? I also wonder if it's the kind of thing that we'd have said to a different kind of welfare professional, to a trainee doctor, for example. So some of that, I think, for me, comes out of some of the practical and the cultural barriers that we have in adult social care when it comes to thinking about how we use evidence. We're under massive workforce, service and financial pressure. We haven't got the time or the space or the capacity to lift our heads up from the day job to think about other ways of doing things. We've had less training budgets and investment and research than other sectors in the past. And some parts of social care as well, I would argue, are perhaps quite task orientated in terms of what they do. It's about doing. It's not necessarily about thinking or reflecting. And it's about the task rather than sometimes the relationship. And that's often the result of the way that our work is structured and the way we're funded to deliver the care that we deliver. But it is a potential barrier. And Impact believes that evidence can make a difference to how we deliver care and a difference to the lives of people who draw on care and support. And when I talk about evidence, I mean it in quite a broad way. I mean insights from different types of research, but I also mean the lived experience of people who draw on care and support and carers. And I also mean the practice knowledge of people who work in social care. And we see those three ways of knowing the world, research, lived experience and practice knowledge, all as important forms of evidence in their own right. They're different but complementary ways of knowing the world, and we need to bring them together to work with them in practice, to compare and contrast, but then to just kind of work with those realities as we bring people together from different parts of the system to work on common problems and hopefully on common solutions. So against that background, Impact is a new evidence centre that's trying to take evidence that already exists and then getting it used in practice to make a difference to services and to people's lives. It's an implementation centre, not a research centre. And it works across the 4 nations of the UK, trying to be really embedded in the different policy and practice context of each of those nations, as well as sharing lessons learned across those different boundaries. And people from across the sector, particularly people in frontline care roles, have told us what would make a difference and indeed what wouldn't make a difference. We started off by asking people what shapes what actually happens in social care. And I'm sure this won't surprise anybody on this call, but people didn't feel that evidence of what works has much impact on what actually happens in adult social care. They thought care was shaped by funding, by national and local politics, by what providers want to offer, by what we've always done in the past, and by sometimes on the bright idea, in inverted commas, which might actually be a bright idea or might not be, of a local leader, a commissioner, or a key figure locally. What happens tends not to be influenced, people felt, by evidence, by good practice from other sectors or from other countries or from other areas of our own country. And sometimes what happens isn't that influenced by what people who draw on care and support or their carers say they actually want and what they need. In response to that, people said, we don't want more evidence, and we don't even want training to work with the evidence that there is. The evidence could always be better, it could always be meaningful, there could be more of it, but there's growing amounts of evidence out there. What we need are three things, people said. First of all, we need practical support on the ground in the realities of local services and the realities of people's lives to use evidence to bring about change. We've got policy that tells us what we ought to be doing. We've got evidence that tells us things that might work, but the hard bit is, well, how do you actually do it? And how do you actually do it in the reality of local services? And how do you do it on a Friday afternoon in Birmingham, in the wrong part of Birmingham when it's raining? You know, that degree of granularity, how do you actually do it in practice? Secondly, people wanted to see the participation of voices that were seldom heard in these debates. And in particular, they talked about people who draw on care and support, unpaid carers, and frontline care workers as all having really important perspectives that could generate better solutions. And then thirdly, people wanted to come together to work with other people on bringing about practical changes together. So Impact as a national centre is now testing a series of different delivery models or ways of working in different parts of the UK that are trying to do all of those three things: provide practical support on the ground, bring people together to do this work with each other, and to enable the participation of people whose voices are seldom heard, including funding for participation where someone isn't otherwise funded to be able to take part and who might be excluded. A care worker on 0 hours contracts might be a really good example of somebody who just wouldn't be able to take part in some of these debates unless that participation was actively supported and enabled. So we've got 4 delivery models, as I say. The first one we call impact demonstrators, and they're for big strategic change issues. And in those situations, a pair of coaches work with a local system for about 12 months to facilitate an evidence-informed, quite a large change project. In the process, they support a local evaluation and they help the local area. They help to take lessons learned from that work at local level and then try and embed it in national policy. The first of our demonstrators is in Mid and East Antrim in Northern Ireland, which is looking at asset-based approaches for older people. Our second model is known as impact networks, and those are for complex but everyday practice issues, where effectively we convene a series of groups all around the country, all working in a very practical way on the same issue in their locality. Might be made up of users, carers, practitioners, managers, and they'd come together with some material from us to start them off. And would then meet in quite a structured way over a 6-month period, feeding back the problems they'd encountered, how they got around them, what they did next, what that started to achieve, and so on. And all those lessons would be collated across all the different groups and then shared back out before the next meeting. And we've got 2 networks underway this year. One is about choice and control for people with mental health problems or learning disabilities and supported living. And the second one will be about values-based recruitment. Could we tackle some of the recruitment issue in social care, or at least make a little bit of a difference to it if we recruited from the broader pool of people by recruiting for the values and the attitudes that people bring, not just the previous roles that they've held. And as an aside, would that lead to better care for people who draw on care and support? And would it lead to better retention because there was a better fit between the value base of the person and the organisation that they were working for? We don't know the answer to that, but that network will be bringing together people across the country who are trying to explore those kinds of issues. The third model, really briefly, is called impact facilitators, and they're based in a local service and they lead a more bottom-up evidence-informed change project at local level. We have one around use of technology in home care in Glasgow, one around personalisation for people from Black and minority ethnic communities in Leicester, and one around support for carers of people with dementia at end of life, hosted by Hospice of the Valleys in Ebbw Vale. And then finally, we have our Ask Impact service that in time will receive questions or challenges or dilemmas from people across the social care sector, and then produce very accessible but still trusted guides or resources in response. The first one that they're just testing is about recruitment and retention in adult social care. What does the evidence say about what works? Just as a slight spoiler alert, the short answer in that draft is that nobody really knows, but there are 4 or 5 things that lots of people are trying, some of which look more promising than others, and then the guide just runs through what those 4 or 5 things are. So really accessible, really short, really kind of in your face, and hopefully quite helpful and practical for key issues that people are facing. This is our pilot year when we're just testing all those different things. And so later in the year, probably in December, we'll be going out to the sector as a whole and inviting different services, different organisations, different parts of the country to express an interest if they want to host future impact projects. And that brings quite a lot of funding into the local service or the local area, with us appointing and supporting the staff that are delivering all that work. For example. So if people are interested in finding out more, they can sign up on the Impact website just to a free monthly newsletter, and that has updates, but it will also have details about how to express an interest in hosting a project in future as well. We're also on Twitter at IMP Adult Care, so that stands for Improving Adult Care. This is just our pilot year, as I said, and I guess we'll know whether impact has been successful in the longer term by a number of formal measures. We're focusing on learning by doing, so we will learn by doing ourselves. And if we try something that doesn't work, we'll do it differently, and then hopefully we'll be better, and then we'll try again, and so on and so forth. But deep down, actually, above and beyond any formal evaluation, I go back to that experience that I started with when I was a social work student all those years ago. If in the future a slightly annoying social work student says, "Why do we do it like that?" rather than shutting them down, as the team manager did to me, hopefully a future person will say, well, do you know what? We do it like that because there's really good evidence based on research, based on people's lived experience, and based on the practice knowledge of expert staff, that this way of doing it makes a real difference to people's lives. And that's how we'll know that an initiative like Impact has been successful. I hope that's helpful, Karolina, just as a kind of starter for 10, and I'm happy to provide more information or to answer questions and to get more involved in the debate as the session goes on.
Thanks a lot, John. That was very, very helpful. Sheereen, are you okay to go next?
Yeah, thanks, Karolina. Thank you very much. So my work really evolves around the social care workforce, and I do a lot of projects around the well-being and the impact of the pay and wages and other aspects of the workforce. I am going to speak today about the particular new initiative of the Centre for Care, which is a really very big investment from the ESRC, the Economic and Social Research Council, and the NIHR in the tune of £10 million for a group of researchers over 5 universities. And this work builds on a previous work that we were, most of us, involved in, which is called Sustainable Care. And it looked at different aspects of care. Among them, of course, is the workforce, which is a core aspect of the delivery of care work. And during the previous work, I led a theme looking at the impact of system shocks. At the time, it was Brexit, on the recruitment and retention of social care workers, and looking at potential solutions and policy direction for that. So the new centre really takes a holistic approach about care, and we are keen to engage with the delivery, provision, and expectations from care across life course. So we've extended our work to include children and families, as long as adults and older people and people living with long-term needs. So our work really has key principles. So in addition to focusing on this life course experience, we think about transition and multiple scales. And transition is not only affecting the person who receives care, but also the person who delivers care, transition from one role to the other, from one setting to the other. And within this also, we are really interested in the kind of exploration of difference and inequality. So there has been quite a lot of evidence around the inequalities experienced even within a very a specific sector where it has certain working conditions that applies to everyone, but within these there are groups which experience further inequalities. So the principles of the center as a whole, which has 3 research groups and 3 themes, and I lead one of those research groups, which is focused on the workforce change, particularly at different levels. So the system level, the what we call the provision level, and then the care workers level as well. And that is sitting within 2 other research groups, one looking at inequalities. So inequalities in the provision of care, particularly when we talk about informal care or care providers. And another one thinking about transition, but taking a migration and cross-border perspective. And 3 cutting themes that we are interested in. One to do with understanding the care ecosystem. So the provision of care, while it's delivered by the front line care workers, does not happen in a vacuum. There is a whole system around it that involves different actors and different stakeholders who shape it. And there is little understanding in the conceptualization of what is the care ecosystem. So there is a whole theme that is trying to understand this and how systems affect the different experiences throughout the system. And then another theme looking at digitalization and technology, because this is a big agenda that is happening across all all industries, and the caregiving, its nature, and the emotional nature and personal relational nature. Digitalization technology can take different forms and can have different implications. So we've embedded a whole theme around that. And last but not least is the infrastructure, data infrastructure. So we know that, reflecting on what John was saying about evidence, that data is key to bring evidence, but data can vary and they have gaps, and some data can tell you something but will be not able to tell you something else. And part of the progress that we can make is building this data infrastructure, whether it's quantitative data, but whether it's qualitative data. So the principles of the whole center revolves around 4 core principles. One to do with social justice and equality. And as I said, we look at this throughout all actors within the care system. We want to make a difference. So there is a priority for us that when we choose a topic to research and we start to organize our work, is to have this dialogue, a continuous dialogue with different actors, to potentially co-produce things, but at least to be engaged and involved and inform the way that we are selecting our priorities, but also how we do our work and what are the key questions that we want to answer. So we have a number of voice forums and partners organizations. The Care Work Charity, of course, is one of our partners, but other partners as well. And we try to keep this dialogue all the time. So we embed it within different key points within our research trajectory. And then also that we need to be responsive, because things are changing very quickly. Things change as part of progression toward a certain policy, but change can happen very suddenly. And we have to be responsive in our nature of doing our research and being attentive and listening to the sector and to policymakers. And here again, the Voice Forum's role is really important in bringing things to our attention. And we also take capacity building very seriously, and we mean by capacity building not only within the academic, which is very important because the social care research sector in general is relatively weak when you compare it to the healthcare research community, for example. So you want to grow a new cadre of researchers, but also we want to train people where care is important for them, whether they are care worker, whether they are care recipients, train them about or raise awareness and discuss with them about the importance of research. So it's not an added exercise. It's very important to maybe stop and reflect and try to understand why things are happening in a certain way and how can we act in a different way to mitigate issues that can affect us negatively. So as I said, I'm going to speak quickly about the specific research group that I'm leading. As I said, it's a core element of it is the change. So it came from when we were writing this, there was a lot of things happening, whether the implementation of the Brexit rules, of course, the COVID-19 pandemic, and also there has been, as we know, a long way into the reforms, and that was coming into fruition, the social care reforms. So it's taking a lens of change, but appreciating and acknowledging that change happens at different places and affects people in different ways, in an unequal way. So we want to dig in deeper into understanding the experience of change at different levels. So we are conceptualizing the care ecosystem that is, you got informed by certain policies, informed by shocks to the system, but also the role of the providers, how they come together, how they innovate, and the workers, how they have a voice, a collective voice or individual voice. And also when these things happen, how it impacts different actors, who may be winning a bit and who may be losing more. So we have our inquiries located at these three levels. One of them is a policy dimension. The next one, we take an interest in innovation, and innovation can take different forms, but one of it is how people organize themselves, how new forms of care work is evolving, how people can bring change if change from above is not happening. And then the third and maybe most important level is the care workers level itself and their well-being and their collective agency or individual agency. And then how these levels interact with each other and how they relate to very neighboring systems like the healthcare and issues of power and equity. So we are now at the stage of formulating our plans of research. We have talked to different groups, but we are very open to ideas and to discussions. And we would, we put in our plans ways to communicate with individual workers, with groups, with representatives from unions to really bring people on board and to ask the right questions. So we have research experience, we have knowledge, but also the lived experience of what is happening on the ground is really important. I want also to link to some of my recent work that has been completed or part of it has been completed, because it's really critical to bring here as a backdrop to this discussion. So I'll talk about two projects. One is at the point of basically concluding, and one recently completed, but we are planning to continue that work. So the first one is about a study called Rescue, which is retention and sustainability in social care, in the social care workforce. And we started this project just before the pandemic. And when the pandemic hit, we realized that the care workforce, the frontline care workers, will have significant implications due to the pandemic. So we actually asked our funder, which was the Health Foundation, and they happily increased a bit of funding to allow us to do research specific to the implications of COVID on the well-being and work outcomes of the care workforce. We conducted a number of surveys, longitudinal surveys. We had a considerable response, even with the time that everybody was very busy. We had nearly, if you put the 3 rounds together, close to 1,700 responses. This is a huge number, but it meant that people wanted to talk about issues. It meant that they will take the time to complete surveys that is talking about something that is very important to their lives. And the results were really kind of shocking in terms of the huge and significant impact that COVID has had, and COVID associated with confused guidance, particularly at the beginning, with sick leaves that people had to cover for others who are falling ill. But one of the things that came up really shockingly is the level of abuse that a care worker has been subjected to in the workplace, even in the streets from the public. So we are taking this further, and we're trying to put together an impact video. So we are talking to people who commented on these issues, who have very strong quotes coming from the survey. So even if it was a quantitative exercise to collect views, people took the time to write evidence and to talk about issues that they are concerned about. So this is one way we thought that is an interesting way to involve people even further, and we're very pleased that Karolina is going to be part of this video. But if people are interested, do drop me a line afterwards. We still got like a couple of weeks that we can still film to add to the video. The other project that links to that and builds on that is the idea that we really need to understand what constitutes the well-being of care workers. So care workers are a very motivated group. They're working in a difficult, generally difficult sector in terms of the working conditions, in terms of pay. But what's interesting, a lot of them are very rewarded emotionally. They want to continue, and that came out actually from the COVID survey as well. That although that they said things were really difficult, we had huge workloads, but we're sticking with the sector. We're not leaving, and that was really interesting. The resilience of the workforce. But also that is in line with the kind of, the government pledges towards listening to the views of the social care workforce and improving the well-being of the health and social care workforce. And we thought it's really important to have a tool to understand what do we mean by well-being, what do we mean by care workers' quality of work, quality of life at work, what does it mean? So we spent 2 years talking to care workers, to care managers, and looking in the literature to put together the components of this tool and instrument to measure the well-being. And we found out that, like other jobs, there are some common factors. So you can't ignore job security, you can't ignore the pay level and support at work. But uniquely to the care, there are other elements that could be even more important. So the time to build relationship, the time to finish training, the dealing with grief and dealing with emotions, and the reality of working so many shifts and how that impacts the sleep quality, or for example, live-in carers who have no control about their food and nutrition. So all of these issues are quite specific to the context of care work. And we are now in the process of applying for further funds. We actually put a first stage application to kind of further this work. So we've done the conceptual framing, and now we want really to validate this instrument. And here is an invite to be with us. So I'm very optimistic to get invited for the second stage, but here is an invite for the care worker charity and also for individual care workers if they want to get involved with the second stage of this work and to play an active part in understanding this and producing something that is meaningful. Because without a tool, you can bring in policy to say, I really want to improve the well-being of staff, but if you can't measure it before you implement any intervention, and after, you can't assess whether that has been successful. And as part of this work as well, our aim was trying to find good examples of practice, and we did find some examples. Primarily, they were very local. Sometimes they are organized by the workers themselves, or innovations that happens from within the community, or interested groups that come together maybe outside of care work, but then try to do something together that is linked to the care work. And we put together like a guide then how we can build on this for providers to support their care workforce. So basically, there is huge opportunities to shape the research agenda, to be active partners in putting together the questions and the tools that we use to investigate our research agenda or inquiry, and of course to be active participants, so to help us to distribute calls for whether it's qualitative interviews or for survey, or to take part in our interviews. And now we are increasingly trying to not only to leave a legacy, but to make an impact, to translate sometimes complicated research methods and complicated methods of analysis to very clear messages that could be accessible by everyone. And we're trying to use the opportunities that social media offer us, and things like YouTube or Twitter, to present findings in a more accessible way. So this is also something people can help us with. And we use this very successfully in a recent project that is looking at live-in care migrants, care workers in London, and vulnerability to labor exploitation. And that had I would say a real impact when we put together the videos and testimonies of people with living in these conditions, and the dilemma between, is it exploitation or is not exploitation? Where are the boundaries? Is that my home or not my home when I'm living with the person? I love the person and I build this relationship, but if that happened from another person, I would never accept this because this is infringing on my rights, and I am actually not paid to do that. So all these complexities of care work and how you deliver it, and the boundaries between the formalities and informalities, and the reliance on perhaps the emotion and motivations of people to come to work in that sector, but really not rewarding them in this way, even allowing them time to build the very relations that they want the reward from it. So as a final note is to say there is a huge opportunity for people to come together to inform our work. I will be dropping Karolina a few links particularly to the Centre for Care. This is an opportune time actually when we are shaping the research agenda for the next 3 years for people to come with ideas, to join our groups, our voice forums. We are always happy to find time to talk to individual or groups of care workers, even if it's outside these voice forums. So it doesn't have to be a commitment. It could be just one time to test us and to see how things could work. We appreciate actually how busy you are, because the way that you work and the way that you have to work, the number of shifts that you have to do to maintain a level of income, we appreciate that this is an additional ask. But if we say that this is not an ask just for the sake of doing research, it's for the sake of change, and we work closely with John and the Impact Center, then that would make sense, and that would give it a value. We try to reward our researchers as much as we can, but we are, so I mean the research participants, but obviously we always have the funding difficulty. We try to do prize draws, but from experience, I think people are rewarded when they are listened to, when they feel that they are actually saying something, and we are we're taking note of that, and we are fitting it into a bigger picture, a jigsaw picture. So that is your part. The providers are doing this, the system is doing this, and here are some ways forward. So without any further ado, I'm going to hand over to the next speaker, and please reach out from me, and do come to the Centre for Care website. We have a Twitter handle as well. I think it's Centre for Care, but I will send all the details to Karolina. Thank you.
Lovely, Sheereen. Thank you very much. And it's great to hear that there have been and there are many different projects around the workforce, because I think if you look a few years back, there definitely weren't many of those around, and that you are really contributing to the research on the well-being of care workers as well, which is very important. Right, Caroline, I see you're ready with your slides.
Yeah, I was just worried I'm not going to get the technology right. So thank you so much, Karolina, for inviting me, and thank you also to Sheereen and John. It's really fascinating to hear about all the work that's going on. Now, my research is, I'm just going to talk a little bit about one study and we're doing at the moment within the Applied Research Collaboration South London. So we're a group sitting at King's College London in the policy unit, and we're doing research with the social care sector in South London, but also North London as well, West London, East London, whole of London. So one of the studies we've been conducting is called The Impact of the Cost of Living Crisis on Social Care Providers. And I'm just going to be talking a little bit about, this is still ongoing, the study, and I'm going to be talking a little bit of what we've found up to now. So I'm not going to go into the background a lot. I think we all know what's going on. Inflation is at an all-time high at the moment, and everybody is experiencing this very much with affordability and higher prices of goods and services, energy prices and groceries and fuel and so on. So this has been going on for a while. We've also now heard that care homes and home care sector have been affected by various pressures in the past years already before COVID. So the cost of living crisis is hitting a sector that's already been under pressure for so many years. So this is a context in which this is all happening at the moment, and we thought that we should have a look at what is happening exactly with this. So in the past months or so, well, various months now, 6 months or so, there's been quite a bit of media attention around the cost of living crisis and what it does to the social care sector. So we do know that it is pushing people and providers over the edge. And these are just a couple of snippets that I found over the internet that is already collecting and reporting some of the evidence. So here in The Guardian, there was recently a newspaper article where a care home manager said, "We're being abandoned again. Energy bill goes up by £100,000 a day." You yourself, Karolina, you have reported that you've had your crisis grant scheme has been supporting a lot more people, and that is, having to support people with fuel costs, grocery costs to feed their families, and it's a really terrifying time for them. So you hear that through your support line. And then, of course, the home care sector is suffering from some of the highest vacancy rates, and the cost of living crisis is also not helping with that at all. So we know the picture here, the background that this study is operating in. There's already a lot there, and we already know a lot about it. So what are we trying to achieve with our qualitative study? Our main aim is still to investigate the impact of the rise of cost of living on small and medium-sized care home and home care providers, so up to 60 employees based in London. So specifically, whether there are any factors in London that people are experiencing that they need support with, and the people working with them. So people working in care homes in all sorts of capacities, and home care agencies as well. So we want to identify very specific support needs for people that can be implemented now without much need to find new ways or long processes. So to already see what we can also use right now. We are doing mostly qualitative interviews, so semi-structured interviews with people, which we try and keep as short as possible so that we don't add to any of the time pressures that people are already experiencing. And we are also collecting some evidence on positive employer practice. So what people are trying to do to support their staff. And we're asking questions whether care workers and their employers know about the different places where they can go for advice and support, and what's already out there. So just to tell you a little bit about what we've found. Of course, it confirms very much the interviews that we have done. It confirms everything that I've already said about, I've already spoken about in the background. So people are struggling to pay for meals. So I've heard from several home care, people working in home care, that sometimes they literally go hungry during shifts because they go into one of the supermarkets and they find that the drink and meal deals and so on have gone up in price and they just can't afford it. Some have abandoned traveling by car. They used to travel by car before, even though that was quite often already difficult, especially in London, because there's some extra fees that people experience here, but more have now decided to not travel by car anymore, which means they have longer commuting times. Traveling by public transport is obviously also expensive, or they're walking. So with these longer commuting times, it also means they can do less shifts, and that means less money for them. Some care homes are really struggling to pay bills and are just saying, we just don't know how to do it anymore. And they're just hoping that there will be something happening for them. So there's this still hope within a situation of hopelessness. And home care agencies are generally really at a loss on how to support their staff. And say we can't really take on more people, more service users, because we just don't know how to fill the shifts anymore. So that's, you know, feeding into the picture that we already knew. But what I also found with the interviews until now is the real impact, the wider impact of the cost of living crisis, and meaning that people just don't have, you know, the means anymore to pay for fuel, to pay for groceries, to pay for their energies. For their energy bills, is this real impact on their mental and physical health. It means, one person said to me, I'm doing much more walking now, working in home care, I'm doing much more walking, but I don't eat as much because I can't afford it and I'm absolutely exhausted. And what Sheereen said earlier, I also, you know, you can see it here, people really want to stay in their jobs. They're very motivated to stay in their jobs. But some have really said to me, and within the interviews, I just don't know whether I can, because it has such an impact on me mentally and physically. And otherwise, also this poverty that people are experiencing is having a much wider impact on people's dependence. So one person told us that they can now no longer send their children to after school activities, which were so important for them, especially coming out of COVID, trying to re-engage in social life, and can now no longer afford that, and can see a real difference in the mental well-being of their child. Another person is supporting their parent abroad in Nigeria, and is saying, I can't do that anymore, which means that there's a real impact on the older parent now in Nigeria. So this is something that is starting to come out of the research that we are doing, is this wider impact of what the crisis is having on people. In terms of hopes for the future, quite a few of the home care agencies have expressed some hopes, some high hopes for the fair cost of care policy, which was announced in autumn 2021. And so that's intended to address the widespread practice of councils paying providers fees that do not adequately cover costs. I'm not going to go into much detail how that is going to work, but it's supposed to come into effect now in October 2023. And there's a substantial amount of money that's being made available to support the councils to get ready to implement this fair cost of care policy. But there is a lot of concerns around implementation. So the Nuffield Trust, for example, did a study of what concerns there are. So we need to, for example, needs to be defined what is fair in this whole policy, and people need to come together and be able to agree. Also, there are some concerns that there whether there's the capacity to implement this policy across the councils. And some of the people that we have interviewed have said, I don't really understand this, and I don't really understand how we can then draw on this and what processes we have to undertake. So there seems to be quite an insecurity and not much knowledge yet of what it's going to mean in practice, and some concerns of whether it's going to be straightforward or not. In terms of also what some of the positive practice from employers towards their staff, people working with them, we found that they're trying to do the best they can by pinpointing people to support services with little flyers, by supporting peer support groups where people can talk and chat with each other. Some have set up lunch boxes and lunch funds to make sure that their staff is actually getting a healthy meal. So those are sort of the smaller things, well, small, but with a big impact that people are trying to do within the means that's possible for them. So this study is still very much ongoing. So it would be really great if anybody who is living and working in London, so it's either a provider of adult social care, so care homes or day centres or home care in London, or if you're working and professionally in adult social care, if you could get in touch with us. For an interview, if you want to have more information, my email address is down here, carolinegreen@kcl.ac.uk. And yeah, that's the end of me for now. Thank you.
Thank you very much, Caroline. That's very helpful. Great. Thanks a lot. Right, so that's the end of your three, I suppose, presentations about the work that you're involved in. And it's very great to hear. And like it's been mentioned, we are going to make sure that we include the links for how to get engaged or how to follow the work once we post this video on YouTube. So please keep an eye out for that. And you can always contact us at the Co-workers Charity if you want to get in touch with either John, Sheereen, or Caroline as well. We're happy to put people in touch. Thank you very much for sharing all of your work. I think my question now would be, in terms of having a new Secretary of State for Health and Social Care, having a new Care Minister, who both of which have just really been appointed, and obviously at the moment we have a period of no work really, but as soon as they get back to it, what are your priorities for the workforce or wider social care? What do you think are the really important things that they should be looking at right now? And Sheereen, could I start with you, please?
Yeah, thanks, Karolina. I think there is a lot of priority areas, but I will take the government on their words about the well-being of the staff, the health and social care staff. And I would push to understand the well-being, because the well-being definitely involves a big financial element. So the material and the financial well-being of care workers is a strong dimension within that. So that would entail that that some changes has to happen in the structuring of work, the pay, the organization of work, and the security of work. So the issues of 0 hours. But if we get in a real conversation with the government, and since this is the pledge, so they haven't pledged increasing funding, or they haven't pledged increasing the pay, they have pledged to listen to the staff and to ensure the well-being of health and social care staff. So that's an important angle to start with. And then they need to show how they're going to go about their pledge, given the recent House of Commons evaluation that I was involved in, and the whole area of well-being of the health and social care workforce was inadequate in terms of what the government have done over the past 5 years. So this is a chance now moving forward and not thinking backward, then, okay, how are we going to take this forward? You know, that there has been loose pledges of increasing the number of care workers, but I think the core is really the well-being, because when you break it down, you come to the emotional well-being, the material well-being, and the physical well-being. So the issues that Caroline has talked about, and it comes from our research, like sleep and eating and walking, and this is physical exhaustion added into a job that demands physical activities and lifting and managing physical demand. So the 3 dimension of physical, emotional, and financial well-being need to be looked at in a scrutiny. And I'll stop here to allow John and Caroline to add into that.
Thank you very much, Sheereen. And I always say that it is an unfair expectation to have of care workers to deliver outstanding or even good care if their well-being isn't in the right place, because we can't really expect somebody who is constantly worried about feeding their children, or who doesn't sleep well at night because they're so tired from actually doing so much work and they have other things to do, to go to work and give their all. I think it's, it is an unfair expectation. I absolutely agree. Well-being of care worker has very direct impact on the quality of care, and is of paramount importance, really, in any work to do with care workers. Caroline, what about you? What would you like to ask of the government?
Well, I'd be interested to hear how to really use the initiative of what's happening right at the moment. So when we're talking of the energy price cap, for example, how that can be used to help and support providers. So, for example, care homes, which we know are really suffering from these energy prices, and what could be done to support them in these ways. So really use policy initiatives right now ongoing, and how to build on those to support others, and also how to maybe use all the support services that are already out there, like yours, for example, to lift those and make it possible for care workers to draw on them and get them through these difficult times.
Thank you very much, Caroline. And John?
Yeah, I think there's one short-term and 2 longer-term things that I'd emphasise. Just in the short term, there's a need for some immediate financial support to just prop up the sector and to stop it falling over. Those financial pressures have been building for some time, but COVID and the cost of living crisis have brought that into even starker relief. So there's just a need for some money. But I think that would buy some time and space to then think through 2 other things for the longer term. And the first one for me is that we often frame adult social care negatively. Care is seen as quite a negative thing, as being dependent on someone else. And we often talk about the kind of crises that there are in the sector. And I wonder whether the scope to frame what we do more positively. Caring for somebody arises out of caring about them, and care is amazing, and it has an amazing impact on people's lives, both the person receiving care and the person giving it, and the relationships that are built. Social care isn't a kind of, it's not dead money that where you have to provide a basic minimum to satisfy public expectations. It's a form of social and economic investment that we make in ourselves as a society, and I think we can get on the front foot about what's amazing about care and about the kind of lives that it allows us all to lead. And linked to that, I'm involved with the House of Lords Adult Social Care Committee at the moment, which is doing a piece of work at the moment, which will report later in the year, around what it's describing as the invisibility of adult social care. And by that, they mean that lots of people receive care and support. Lots of people are unpaid carers, lots of people work in adult social care, and lots of people do some combination of all those different things. And yet, as a society, adult social care is still relatively invisible. We don't talk about it very often. We don't like to think about some of what it involves. It's often neglected by policymakers. It's often neglected in the media. It's not as politically or as publicly popular as something like the health service, for example. And their argument is that we need to do something more fundamental about the visibility of adult social care in order to tackle some of the other very real and very practical issues that have arisen. And pay is a really good example. I'd argue that as a society, we don't value people who draw on care and support as much as we should, and therefore we don't value some of the people who work with them as much as we should, and that plays out in things like pay. In the area where I live, I did a session with the Archbishop's Commission on Reimagining Care, and I went online just before I did the session, and you can work as a home carer in the part of Birmingham where I live for minimum wage, or you can be a dog walker for £15 an hour. That's the reality of the kind of society we live in, and the sort of choices that we make and the priorities that we have. And so until something shifts more generally about the profile of care, but about the extent to which we value each other and value our relationships, then some of those other very real, very practical issues might not shift otherwise. So that funding is needed now, but it might buy some time and space to tackle some longer term issues, to not just prop up a system, but to rethink it and to get more on the front foot going forwards.
Thank you very much, and I definitely agree that social care isn't a place where money goes to die, but it has a huge social and economic impact, and it makes huge contributions. And I think that's not spoken about enough. Like you say, it is hidden, and I think it is hidden because people are embarrassed. We are still not talking enough about health issues. We're still not talking enough about dying. We want to keep all of that behind closed doors, not think about it unless we have to. And that's why I think one of the contributing factors it is that we don't really invest enough in social care, and we want it to just happen without too much thought, too much investment into it. Right. Well, thank you very much to all three of you for this afternoon, for sharing your work, for doing it in the first place, and for putting huge amounts of your time and effort and your work life into research, implementation of research, and trying to understand situation of care workers and how to improve it, because that's really the important thing, isn't it? It's understanding it. Yes, it is important, but I think over the years, we've learned to understand quite a lot of it. We've talked about pay being an issue for how many years now. Now we need to also look at ways, and your research helps us with that, on how we can improve the situation that care workers find themselves in, so they are happier. And of course, if they are happier and they feel better, they can deliver even better care, and they want to continue doing the jobs they're so good at doing. So thanks again to Sheereen, Caroline, and John. Like I mentioned before, this video will be available online hopefully soon. And thank you for anybody who's watched live today, and anybody who'll be watching recorded session later on. And have a lovely afternoon. Thank you.